Hi, I'm Sarah Dionne, and welcome to the Attuned Clinician, where we talk about everything complex trauma and dissociation and learn about these things, these difficult client experiences, through the lens of supervision and consulting. Welcome to the Attuned Clinician. I'm so glad that you're here, and this is the first video ever. So this is an introduction to who I am and to what this channel is going to be all about. And I hope I get to keep you until the end. I'm going to make it brief so that you can get to know what's happening here and be ready for the next video. I specialize in treating complex trauma and dissociation and dissociative disorders. Unfortunately, most master's degrees don't offer enough guidance on how to treat these very, very difficult experiences that clients are having. And they are also tough to treat if we don't know the skills to use, because they're pretty specific, yet at the exact same time nuanced. How we put those different methods together, how we interweave them, and how we apply them in session. I provide clinicians supervision around their practice and most specifically, complex trauma and dissociation. I support them in learning best practices in caring for these very vulnerable people, how to support them through somatic therapies based in IFS, and life-centered therapy. I want to help clinicians really understand these clients from an attuned perspective, yet at the same time, my supervision is very different than what most supervisors provide. My clinical supervision is really based on the clinician. I'm clinician focused. The reason for that is that when we focus in on the clinician, then as they firm their foundation, they sort through their responses to the client, then that will simply elevate their ability to help their clients. In consulting, I offer a very similar method of that attunement, yet it's attuning to the environment of the practice, the team. I work with supervisors and practice owners and agencies to help them navigate when there's issues within the team, when there's discord, or if clinicians are feeling overwhelmed by these clients that are coming in the door that have complex trauma, that have severe, significant issues that have occurred even more recently in their lives, but over several years, which can also create complex trauma. And then dissociation. If someone walks in the door with dissociative identity disorder, then unless we really understand how to treat that and really know what's needed and how to guide that client, when to slow the client down, that will be very scary, and oftentimes will cause the clinician to have to refer that person out. And there may not be someone within their agency that they know of that can provide that expert treatment. But what if the clinician knew that they had a supervisor behind them that could help them through, that they didn't have to refer this person out, and how that would help the clinician's confidence as they grow with the client. They're growing as well within themselves, within their ability. And this can affect the clinician in many ways. It can affect them in their ability to serve the client, but it also affects us in our personal lives. As we learn about ourselves through being a therapist within the therapeutic relationship, then it can also improve our personal lives because we're learning about ourselves as we sit across from the client. I'm able to provide this support because I've been in the practice of psychotherapy for almost 19 years, and I've also owned my own private practice for 7 years. And today I have a practice, Sarah Dionne and Associates, where I hire clinicians, provide free supervision, and education training on how to use somatic based therapies, therapies that are based in EMDR but not the full protocol, therapies based in IFS and also based in life-centered therapy. While I also draw from many other different types of therapies, including DBT, CBT, um, and the enormous amount of acronyms of therapies that we can draw from. On this channel, what you're going to find are some very training focused videos on how to apply this method, how to apply this method to this type of client, how to sit across from this client, how do we manage how we're physically responding to this type of information or this type of story that can be incredibly overwhelming. Also, I'm going to provide a mock supervision in which I will, watch a video with you or have a vignette and we'll talk about that. And I'll provide supervision through an attuned lens so that you can witness how I do things, but also gain from that, learn from that, perhaps begin to witness your own clients through that attuned lens, understand them on a much more broad, deep level, and also strategies how to lean back into yourself, even during a session, how to ground, be with the self, sense into body sensations that may be arising for you, how to hold that through the session, what to do after that in the session, or I mean after the session. That can be very difficult when we're dealing with extreme trauma. We can face vicarious traumatization, and so I will cover that. How do we notice that that's happening? If we're working with many, many people that are have suffered extraordinary trauma, or maybe just one particular one that just gets our heart, we can be vicariously traumatized. So how to manage that? How to watch out for it? What to do about it if you notice that that's happening for you? I'm also going to be inviting clinicians on the channel so that you can see a more interactive, real-time supervision through that attuned lens. And you can learn from that and apply it and begin to see your own clients through that if it works for you, if it applies or resonates for you. I'm inviting comments or questions, and I'll be looking out for that and doing my best to answer all of them in ways that are meaningful within videos, or perhaps covering content that people seem to be interested in learning more about when it comes to complex trauma and dissociation. Later on in the channel, I'm going to be telling my own personal story with complex trauma. Yet, I'm not going to be sharing all of the little details that really are not necessary. I'm going to be sharing it for the purpose of inspiration and understanding and growth. How things worked for me, what was my journey like, what supported me, what didn't help me, and how I was able to eventually receive the help that I needed to begin rebuilding an internal foundation. And that's really where the story will focus on as we progress in the channel. I'm glad if I was able to keep you to the end of this video, and even if you didn't stay, I'm still glad that you came. And of course, subscribing will only help me grow this channel and help more people, clinicians and survivors alike. I really hope to see you next time. All good things.